Hello everyone, myself Sushmita. Today we are here to discuss on a certain topic which is also the second most leading cause of death all across the globe. It is suicide. The fact that being said, we must realize that the very reason people avoid talking about it is the very reason we must address it. Today in the world there are a lot of perceptions and opinions about suicide, but then again most of them are not credible enough. And therefore, we have with us two of our medicals experts who will be sharing their opinions and discussing the the topic which is like suicidal behavior, the potential cues and how one can prevent it. Today, we have with us Ms. Anushila Brahmachari, sports psychologist and counselor. She has been associated with Medica for over 8 years and she specializes in performance management, anxiety and stress management. Along with her, we have Dr. Arijit Dutta Chowdhury. He has over 17 years of experience in his field and he expertises in de-addiction psychiatry, child, adult and adolescent psychiatry. So, we'll be beginning today's discussion with Ms. Anushila Brahmachari, where my question to her is, can you explain the kind of people or the age and demographics of the people who are susceptible to committing suicide or think about committing suicide?
Thank you, Shushmita, for the question. Let me start with a very interesting but a very scary trivia. As we are speaking now, somebody is committing suicide. It is that prevalent. So basically there is someone attempting suicide every 40 seconds. And if we can sum up globally, there are 8 lakh cases of suicides every year, out of which 1 lakh is from India only. Now, if you ask who are the people who are most susceptible to commit suicide, of course, the most turbulent age of our lives, our adolescence. 15 to 29 years of age is the most vulnerable age for attempting suicide. You will see that maximum deaths at the age between 15 to 29 are caused because of suicide. Apart from that, there is also a gender factor. Women are at a double risk in comparison to men in terms of committing suicide. Very interestingly, in the last 2 years, our world has seen something that we have never seen before, the COVID-19 pandemic, and that has also changed a lot in the numbers. There has been a 10% increase from 2020 onwards in the suicide rates in India. You will be surprised to know the first leading people who have been committing suicide from 2020 onwards in India are the laborers. It is immediately followed by the homemakers. So any section of our society, if you take, you will see there is a potential risk of attempting suicide because of the increasing stress, depression and anxiety amongst us in the society.
And just to add, it is not only like one is committing per 40 seconds, one is trying per 1.5 seconds globally.
Wow.
One is trying to commit per 1.5 seconds, one person.
It's a very slim window.
Yeah.
Yes.
Very slim window.
Can you tell us more about the methods of the common ways people try to commit suicide or are into it?
Okay, methods and cause
Yes.
Okay. So I think before the methods I will tell the causes, okay, because everything has a cause. So in case of suicide we see around 95% have some kind of mental disorder. So when we see the news of suicide in newspapers, and there are like many stories why it had happened, but the mental disorder which was there maybe that is usually not focused. Usually it is highlighted like what particular difficulty the person is having at that moment, but the fact is 95% of them have some kind of psychiatric disorder, treated or untreated. And most of this among the psychiatric disorder, the commonest is depression and mood disorders, which is almost 80%, and then another 10% schizophrenia, another 10% maybe personality disorder, substance abuse, maybe a comorbidity. So I am not going into the details of that. Rather than I will talk about the causes in a psychological way, like whatever the disorder is, what is the psychology behind. Like a person may be having depression, but not all persons with depression are going to commit suicides, or not all persons with bipolarity or schizophrenia is going to commit suicide. So what is the psychology? So the very initial psychological theories like Freud, Jung, they used to tell that suicide is actually, it's a anger or homicidal impulse, because the person is so depressed that he actually wants to kill someone, actually hold someone responsible for the situation and wants to kill somebody, but he cannot do it for the legal and social problems, so he inverts it towards himself, he kills himself. This was the initial theories, but later psychological theories came, like which were modern theories. They tell suicide is more like, for a depressed person, it is more like a fantasy thinking. Like when a person is very depressed, he fantasizes what can happen when he is not there. That thought actually provokes people to commit suicide. Like, what will happen if, say, I want to take revenge on somebody. So if I commit a suicide, what will happen to that person? Or there are people who think that if they commit suicide, they can go back to their loved ones who believe in this kind of thoughts, like lovers. They believe that I can join someone, that is also a thought. Or maybe there is a thought like extreme poverty and all, people think that if I commit suicide, there will be less burden on my family, this kind of thoughts.
Self-loathing.
Yeah, so these kind of thoughts, like fantasy thinkings, mostly like what benefits can happen or what good things can happen out of my death. That is, yeah, if you are that kind of depressed. So these are the modern psychological theories. And then we come to the sociological theories.
I know.
Yeah.
I was thinking I'll just completely agree with what you were just saying. You will see that there is a huge factor associated with the socio-economic status of a person in terms of how much the person will be susceptible towards attempting suicide. Like, once again, I'll go back with your examples. In the pandemic period, we have seen a lot of stress and depression, and a lot has been caused by financial losses
hardship,
and loss of job. We have seen that so many cases of suicide has been reported because of that. So financial cause becomes a very important stressor point and a cause of suicide. Apart from that, everything that he mentioned, particularly the psychological disorders, particularly depression. Depression, I think, rates as the
highest,
highest most
almost
reason,
80% is depression and bipolar combined, like mood disorders combined.
Right. So any such symptoms can be potential threat for any person to commit suicide.
Yeah. Then there are other sociological theories, like in society we say there is cohesion is very important for a person to not become suicidal. So people who have less of cohesion, like we say religion is a big cohesion. So people who are completely atheist, non-religious, they have a higher risk. People who don't have a close community, like urban suicide rate is slightly higher because rural communities still have a more cohesive community. Then we have these people who are single, unmarried, divorced, separated, they have a higher rate of suicide. So that cohesion is a big factor if you think about the sociological causes like society. Then we have this kind of thing like altruistic suicide, which is it is suicide bombers. Why they cause suicide? Because they believe in a higher reason. Like, by committing suicide, I am actually benefiting my community or some people. So that is called, just the Japanese do harakiri, because they think if they commit suicide by harakiri, the state secrets won't be given to the enemies, because the enemies will torture and take out the state secrets in a war. So that kind of suicide also happens. This is a sociological cause. And then there is another cause which is called anomic suicide. That is like a sudden change in the status of life. Like, it can be financial, as you were saying. I was having a nice life, suddenly I see I am so poor that I cannot maintain that, and I think no, it is better to die rather than living in this way. Similarly, it happens with love. Someone is having an affair, so suddenly the partner goes and they think that I cannot live without her or him. So that also causes suicide.
It is also true for sudden loss of loved ones as well.
Yeah.
When we lose someone very close in the
Very
family,
close.
a sudden shock can also
not necessarily a lover, it can be brother or sister or parents, anybody.
Well.
And then coming to the methods, globally the most used method is hanging. 50% of suicides are caused by hanging. Okay. And another 30% is caused by this poisoning, pesticides, etc. and then another 15% by firearms, 15-20%. So this is the global, but then there is a difference according to culture. Like USA, firearm is much more, around 45%, because availability of firearm, the loose rules there. Similarly in India, the Indian Asia, this poisoning pesticide, this is more because it is very easily available here. The more of agricultural area, rural area, they use more of this. But the overall thing is, highest is hanging, then poisoning, then firearms. That is the usual methods of suicide.
Ma'am, can you, like, my next question is to you, like, can you describe the circumstances or the situations? Like, I know you discussed it fairly, but like, what actually, like, what is going through that person's head? What actually drives him to think that this is, like, what makes a person plan that I am going to take this step now?
Right. See, like Sir explained, that there are two kinds of suicide. There is suicide driven by bigger motive.
Yes.
And there are suicides
Driven by emotion.
by emotion. It's a momentary lapse of reason
Judgment.
or an impulse that is driving you to do
Take
something
such
to harm yourself. That feeling, the previous one, is a kind of indoctrination or a kind of driven motive and planned behavior, which is a very different kind of motive. But the second one, more prevalent, is a momentary lapse of reason caused by a sudden feeling that whatever is going on in my life, there is no way out, and it is easier for me to kill myself than to deal with that. Such feelings can be aroused in any of us at any given point, actually.
Okay. My question is, like, how long does it take for such emotions to manifest in such a way that a person is actually believing that this is my only way out? Like,
Right.
if I talk about a person who is going through a family, in disposition where he has no means to get by, or like any other domestic reason, the person has issues to be depressed. But what makes him take? Like, what really makes him choose that rather than taking the other?
Right.
Actually, the public notion is that suicide is mostly impulsive, like suddenly one fails in exam and commits suicide, but those are not common. That is what we see in newspapers, because that is a news that you read, because that is a news. But the more common things are very well planned. Usually those who commit suicide, they plan in advance, and they usually talk about it to somebody. People think that talking about suicide is like someone is talking about, he won't do it. It is just opposite. Someone is talking about it means he is a candidate who can do it. And usually there is long plans, like what will happen if I'm not there. Many people make wills, many people make the methods of procuring. If I want to get some poison, so most of there is it is pre-planned.
Right.
Impulsive thing is less. It is there, but it is much less.
Okay, but I was trying to emphasize on the trauma aspect of it, like when you asked, who can commit suicide and when. Say, like right now, we three are sitting in, one of us is, for example, me. At this moment, if I get a very traumatic news which is emotionally shattering for me, how I will react right now is very hard to predict. Now, all the predictions or the probabilities of me behaving in a certain way is based on my personality, my existing comorbidities, mental health issues that I have. Many people have underlying comorbidities around mental health issues that are brewing over a long period of time, and we do not identify them. And that's what he has been saying. It manifests as a news when someone is attempting suicide, but probably things are brewing for a long period of time. One very common example is suicidal ideation. When we get angry in Bengali households, it's very common. When we are saying it, we are expressing our anger, or we are actually manifesting this desire to actually die. Sometimes it becomes very hard to discriminate between the two. If it is the latter, you will see certain things that a person is repeating the same thought over and over again, researching, planning, and like he said, making wills or giving away things, and overall withdrawal, a general lack of interest in life can often manifest when the person is actually planning for it. But on the other hand, I have seen several cases of suicide. Unfortunately, many of them could not be saved also. Like very common examples, when results come out. Parents, they get upset when if your result is not so good. Probably you were not studying properly. We don't know why you were not studying properly. What was stopping you from, putting in your best efforts? From a parental perspective, you just see that your child didn't put in the best effort, and of course you get upset because it hampers your child's career. But at that moment, when the result is out, I will particularly mention this to the parents because sometimes we lose our calm and we just
critical comments.
We become very critical and they become very hurtful. That can act as trigger to many children to attempt to commit suicide, and that has happened in our lives. That the child itself, no matter how reluctant the child was to study, the child, when the result is there in his or her hand and it is not so good, the child is already ashamed and humiliated.
A very common comment in Bengali is তোর দ্বারা পড়াশোনা হবে না।
তোর দ্বারা পড়াশোনা হবে না, তুই গোল্লায় যাবি, তুই কিচ্ছু করতে পারবি না। So it is constantly affecting your self-esteem, your belief in yourself, and your ability to able to achieve anything. So when that child is attempting suicide, unfortunately many of them become successful. But if you are successful in saving that child, that is not the end of that story. Okay, hoye gelo, suicide hoye geche, bachi na hoyeche, and now let's move on with our lives. No, please. What did that event leave a mark on that child? What mark did that event leave on that child? We have to explore that. We have to see that. Sometimes we miss on exploring that. That's why suicidal ideation becomes very important, like he was mentioning. If there are some casual beliefs about suicidal ideation also, you will notice that every other day this person says more jabe, every other day attempts suicide.
যারা বলে তারা করে না, that is a very common notion.
Exactly, that's another common notion. Or it is an attention seeking behavior, they are trying to commit suicide every other day just to draw attention of the people around them. Why is such a thing happening? If that person is coping in that way, that's a maladaptive coping. We still have to understand the underlying root causes towards that, and that can be many things, many of which sir has mentioned already. Like it can be finances, it can be relationship, it can be family issues, it can be many things, but the core thing becomes your identity, your sense of isolation, your feeling of being misunderstood, and the loneliness that drives you to feel and take this decision that when I am in this world and no one around me is understanding me, that's a very isolated place, that's a very lonely place, and hence it's rather better that I die.
Another thing we see, especially after this Sushant Singh Rajput committed suicide, that there are people, his fans, who were basically depressed, but once he did, they followed. Like it is called a copycat suicide.
True, yes. True.
That is
I think we haven't met any of our patients during that time who haven't spoken about Sushant.
Yeah.
And that was a huge trauma for many people.
Immediately the number of suicides increased during that time.
True. His followers and everyone was shocked that how can a celebrity like him, who is such a successful actor, committing suicide. Ki kore eta korlo was all over the place.
Definitely.
And usually they also copy the method, like method also is copied.
Showing solidarity to the person they look up to.
So now for these people, like, is it just because of their emotion towards the person who has done the same? Like, is it because, or is it something else, or they have been already had the feeling that they want to do something?
Yeah, mostly it was brewing inside. Now it gets a stimulus. Like I was doing something, suddenly I get a cause, reason
from
to
my hero, or my ideal person. I
was standing by the side of a swimming pool and contemplating whether I should jump, and someone gave me a push from behind. I jumped. Like that.
It also acts like a shock. If he has to die, then why should I live? Because I am already feeling so miserable.
That is true.
Then there is an identification that is created. So that happened with everyone, because we have a general notion that celebrities, they are living the best of the lives. How come they are committing suicide? It's not true for celebrities, rather it's more
and
difficult.
the newspapers also, they focus like he left this many crores of rupees in bank, this many
right.
cars and all these things.
Those
Why
gossips
if
and all.
if he goes with leaving all these things, what I am doing?
Exactly.
My next question is like, can being sick, like terminally sick, drive a person to commit suicide? And if so, why do they think like being like they're already in the process of getting better or not getting better, they're going through a journey altogether? Is it because of the stress or like the depression of like, you know, going under that treatment that is making them think that they have no way out?
So this is a very interesting question, because it raises a lot of debate. In some countries, chronically ill people can opt for euthanasia. In our country, it is not an option.
That's illegal, yes.
Yeah, but
we had a film also.
Exactly. We had a film also on that. So this is a question much in debate. From the perspective of a patient, any chronic illness is always coming along with a set of psychological problems. Okay, even when the person is gonna get better and the rehabilitation period is a long period time, during that period of time also many patients go through depression and major coping issues. Now, if someone is terminally ill or chronically ill over a long period of time, or going through a very painful treatment procedure, the quality of life diminishes for that person. The sense of autonomy diminishes. Imagine I'm walking, talking, doing everything by myself, my sense of dignity is intact, and suddenly I am on this bed at your mercy for my basic needs, even to pass the urine, or you know, for my one spoon of food or even one gulp of water, I'm relying on you. For a person with a lot of self-esteem and dignity, it is a huge hit, which is the case for most of us. And if that is going on for a long period of time, and then the suffering, the physical suffering is simultaneously there. And what happens is, initially when the illness starts, there's a lot of support. But when it extends for a long period of time, people have their lives, they have to move on, they have to do their things. And the physical presence of people reduce. The sense of feeling unwanted, feeling redundant sets in that person at that moment, and such reasons can often induce a sense of lack of purpose in that person, and hence the person might feel এর থেকে বেশি আমি মরে গেলেই ভালো হতো, আমি বাঁচতে চাই না আর, and hence I want to die. You will see many chronically ill patients who will not get better, probably will have to maintain a quality of life that way.
They have to stay in the hospital, or like they have
or under the care for a long period of time. What they try to do is they show some redirected aggression towards themselves. They give up on their meds, they give up on their basic care in terms of food,
they ignore, like reject everything that is being done to them for during their treatment. They
True.
And that stems from their like sense of loss of dignity.
Exactly. And it's very hard to tell what's going on within them at that point.
Right.
At that point, in that chronic situation, therapy becomes very important at that point to make them.
So you would advocate like therapy is like needed when like for such kind of people?
In any kind
Definitely.
of chronic condition, when the person is suffering for a long period of time through physical illnesses, I think we both have enough experience how much we have to chip in terms of pharmacological support.
And also if you have seen the this cancer care facilities who deal only with oncological cases, they always have in-house psychiatrists and psychologists, because almost all of them need counseling or even medicine if it is higher depression. So always, because usually they are in pain, so depression, what it causes, it increases the pain threshold is lower. So always, like terminal illness, always you need therapy, not only therapy, medicine as well.
So that from here, my next question is to you only. Like, can you explain us, like, is there, according to you, is there any biological reason behind as to why a person tries to commit suicide?
Already told you the psychological and sociological reasons. Now, yeah, definitely there is biology. As I said, because there are maybe 10 patients of depression, but only one will commit suicide, not all of them. So, why that particular person? So, other than the psychological causes already explained, biological causes are there. We have seen like twin studies. One of them commits suicide, the other person, the other twin, very high chance of committing suicide or at least attempting. Then there are adoption studies. When a child is adopted, the adopting for the parents, they don't have any family history of suicide or depression, but still the patient, if his biological parents have history of suicide, so they often commit suicide or attempt suicide. So this is very strong genetics, because this person is in a different environment. So environmental issues is not there, still it is because of his genetics. Now we have found a gene also, SK2 gene. So research shows that the SK2 gene expression is less in people who commit suicide or who attempt suicide. And then there is a neurotransmitter, there is serotonin. So there is a metabolite of serotonin which is 5-HIAA, which is found less in the patients who commit suicides. So all these point towards a very strong biological cause. And there is another thing, early childhood trauma, like sexual abuse or physical abuse in very early childhood, that also causes a patient vulnerable to suicide. That actually hampers the patient's ability to take stress. So what is suicide? Basically, a certain point the level of taking the stress, coping strategy fails. So early childhood trauma, it hampers the coping strategy, and that actually does it by the biological mechanism, which there is something called hypothalamo-pituitary adrenal axis, which is responsible for handling stress. That axis is not functioning well in people with case of early trauma. So there we have these 4 or 5 different indicators that yes, suicide has got a very strong biological underpinning in addition to the psychological and social things.
This question is for both of you actually. Can you guys tell us about the risk factors and how one can identify the potential cues? Post that we'll go into like how we can deal with like post attemptees and like their treatment. But before that, we'd like to know this.
Right. So I'll break it down in 3 sections. One is a sudden trauma that I just mentioned. If I just now get a bad news, I will be at a high risk of committing suicide, because I don't know what dormant psychological traits I have within myself. So how I am going to react in a very high stressful situation is not predictable.
It's not known to you.
So whenever a person is getting exposed to an emotional trauma of a very high intensity, which is making the person very upset, the person should be taken care of specially so that the person can be saved from any self-harm behavior. The second would be the suicidal ideation. We neglect suicidal ideation thoughts when repeated too much. We neglect them. Bole kore na. We talked about this a while ago. If there is a suicidal ideation and that is being repeated over a long period of time, it has to be noted, it has to be checked, and it has to be investigated clinically so that we can understand where the person is feeling this lack of coping, that this suicidal ideation is brewing, because you don't know when the person might actually act upon it at one point. And the third thing is there are certain subtle cues that we often miss because they are very silent. Sudden change in behavior, erratic responses, or sudden unusual responses can be an indicator that the person is planning to, commit suicide. That can be irritable behavior, withdrawal behavior, sense of isolation, making wills, giving away stuff. Suddenly a change in sleep patterns can also indicate that the person is planning something suicidal. They are very similar to the depressive symptoms. So if you identify someone with any kind of withdrawal symptoms of any sort, societal or personal withdrawal, you have to take a note. Actually, that was very much promoted in the last 2 years when we were fighting the pandemic as a community together. It is very important for each of us to check on each other intermittently, particularly in terms of the introverts when they cannot express what is going on within them, but yet they are suffering inside. A little question, a little nudge can, break the wall, and it can enable them to speak up what is bothering. So we can actually save that. Patients with suicidal ideation, I often tell them that they should at least have one commitment with themselves, that if ever I get a feeling that I should harm myself, I should have 3 names with their phone numbers in my pocket all the time. I'll take that paper out and read that before committing anything to harm myself, I should at least call and talk to one of these people. It is a very common and effective method. It can be done. Hotlines are also there that can be used.
Suicide helplines, yes.
Yes, helplines can also be useful. So these are the indicators. We have to be very watchful about these, and if these supports are there, that becomes much effective in bringing down the numbers.
So there is certain risk factors also, like the most foremost risk factor is untreated psychiatric illness.
Right.
Many cases the psychiatric illness is there, not treated. When escalates to suicide, then we take notice. So that is a very important factor. Then this addiction, then this homosexuality, these other sexual behaviors, transgender, all these people they are at high risk. Then criminal behavior, history of criminality in the past. The person who can hurt others, they can hurt themselves also in a higher frequency. Then I already mentioned divorce, separated, those people. Then family history of suicide, that is very important. If someone in the family has got a history, then and that person gets some kind of mental illness, we have to be double watchful, very strong genetic and biological. So that is very important.
Exactly.
And past history of suicide attempt. The person who has attempted in the past, it is very likely that he will again attempt. Usually there are multiple attempts, usually. So these are the risk factors which we should identify, and we should tell the family members.
I would actually put a special mention on the marginalized group. You mentioned this. Actually, to the audience, we are not very familiar with the marginalized group in the society still. They exist, they are not sick, they are not abnormal. They are just an equal member of the society. And just because we have a very biased, exactly, we have a very biased notion towards them, they develop mental health issues much more than other people. And it is not recommended, it is not justified, and particularly friends and families of non-normative people, please be sensitive towards your family members and support them through their...
That is what kind of drives them, I believe, like the fact that they are being judged by their near and dear ones, the fact that they are being misunderstood.
Not normal.
Exactly, like growing up with a loving father thinking like, my dad is so proud of me.
Even we get people, they come to us कि sir इसको treat करके ठीक कर दीजिए.
जी हाँ, treat करके ठीक कर दीजिए.
Don't even know this is, it cannot be treated. Exactly. It is not a disorder.
So it is your problem that you cannot accept your child's identity. It is you that needs to understand that the way you expected your child to be and the way your child is different. So that understanding has to be created. We need to be more sensitive and sensitized about this matter.
So here's my last question. For people who have avoided, avoided the fight, yes, who have finally who've survived it actually, the post-attemptees. We've just discussed they are again susceptible to committing suicide over and over again. They'll keep on continuing unless there's an intervention, right? So is there any treatment? What is that intervention for these post-attemptees? What should they do? That's it. How much of a big risk are they again to committing it again? Yeah.
I think it should be a combination of medicines and therapy both, and that's how we work in Medica right now. So when patients are referred to us who have attempted suicide, we meet them, he helps them with the medicine, and we also sensitize their families about the importance of therapy. So that's what we do. We try to understand what are the root causes, what are the pathologies that the person might have been having from before. Is there any kind of psychological illness that the person is suffering from which is unidentified, or what are the stressor areas and how we can resolve them. So therapy becomes very important, hand in hand with medicine. Family support from the peer group becomes very important. When someone attempts suicide, the first thing that happens, which you mentioned initially, the social stigma, that you go back home feeling like you have committed a crime, so shy and ashamed. There is very little empathy, and there's a lot of gossip around such patients that pushes them more towards the edge than pulling them back. I think we need to be very sensitive about this and work as a community together. Yes, there will be therapy. CBT is very effective for suicide prevention in terms of therapy. So we'll talk about medication, but in terms of a community, we have a role to play. As a community, ও তো সুইসাইড করেছে, ও বাবা ও জানো ওর কি গল্প, ও তো সুইসাইড করেছিল. These kind of gossips and backtalks are very detrimental for the person. Treatment or healing or bouncing back. We need to be very sensitive and avoid such.
For any normal person, like paying heed to gossip kind of does weird things to your brain.
Yeah, exactly. It's a very detrimental effect. And even the family members, how could you do such a thing? You couldn't think about us. This is not about you. To the family members, this is not about you at that moment. It is about that person who is feeling that weak that decided to
driven to taking that step.
The role of medicine, obviously, as I said, 95% of them have some kind of psychiatric disorder. So once we identify the psychiatric disorder, we treat according to it, like depression with antidepressants, schizophrenia, psychosis with antipsychotics, bipolar with mood stabilizers. So these are the common treatment we do. Then particularly for suicide, there is one particular medicine, that is lithium, which is an iron which is not normally present in our food or anything like that, but we give it from outside. It's just for its anti-suicidal property in addition to all other medicines. Even it is so effective that there are places on the earth where there is lithium is there naturally in water, and people drink it and they have very less amount of suicide. It is that kind of anti-suicidal property it has got. But usually people are very scared of this. I have seen many times that a person on lithium, a physician has seen or like who is not that much aware of it and stopped it in fear because there are many side effects and all, but it is a very good anti-suicidal drug. And I can tell at least I have few patients who are on ventilator. They tried suicide, it was so severe, they are on ventilator, they came back. I have treated them with psychotropic drugs, especially lithium, and they are so successful in life, like career, marriage, everything. So it can actually give you a new life when it comes to the drugs. And obviously therapy is very important.
So how long does this therapy extend? Like for how long does it?
Medical treatment, it depends actually on the diagnosis. For mood disorders, it can be as low as 1 year to as long as 5 years. For some people, lifetime. For schizophrenia, it usually a longer period. So it depends on the diagnosis. Okay, so usually it is for someone who has committed suicide, it is slightly on the longer term because we want to give protection to that person. Someone only with a depression and someone with depression and suicidal attempt, obviously I will treat him or her for a longer period.
Sure.
It is there, yeah. And obviously the improvement, like the science, the modern science, which is over say last, I am practicing for 17 years. So the medicines I had 17 years back and what I have now, there is a big difference. Like my options are much more, side effects are much less. So the earlier people used to have a lot of side effects, so they did not want to take, and there are a lot of stigma about the medicines. Modern medicines are very good, less of side effects, so people tolerate better. The awareness is already growing, so it's far better now.
Yeah, I think it's very important to note this point because many patients feel a little bit hesitant to take medication because there's a taboo associated with it. Psychiatric medication never pagal.
And the taboo is not only in India, it is all over the world.
It's all over the world.
We think it is here, it is everywhere.
True, that's true.
Even in developed countries, nobody want to take the pills.
Medication. Yes, it's like a certification of you are bonkers. That's absolutely a bad taboo, And just like when we get physically ill, we need some medication to get better. When we are feeling emotional distress, and only therapy cannot work always. You will not be able to act to the therapy. You will not be able to
For
participate.
therapy, you need to be in that
State of
state
mind.
to take it.
Yeah. For that, please do not be reluctant in terms of taking medication, because it can actually save your family member's life. That becomes very important.
True. So, ma'am, do you guys have anything else to share? Like, we'd like to end the discussion here.
Only one message, that is, if you ever feel suicidal, tell it to somebody. Don't keep it to yourself.
Yes. Please speak up.
Please
The
speak
first
up.
thing is-
It may not be a clinician or a psychiatrist, psychologist. It can be your friend, it can be your brother, whoever. But please speak up.
Yeah. That one phone call can make a lot of difference. That immediate impulse, if you can hold it.
Now from Indian Psychiatrist Society, we have started a helpline also.
Yeah.
Where always a qualified psychiatrist or psychologist takes the call.
Yes. It is not a shameful thing that you're feeling suicidal. It doesn't make you a weak person. Anyone can feel that I do not want to live anymore, and that's okay. But to reach out becomes very important.
Okay, thank you.
Thank you.
Thank you.